Assalamu alaikum everyone. This is Amar bin Salim. I represent the marketing team at the Office of Advancement at LUMS, and I am privileged to be your host for the Knowledge Week series that we have been doing for Suleiman Dawood School of Business at LUMS. SDSB, which is short for Suleiman Dawood School of Business, is the first and the only business school in the country to have scored the AACSB accreditation, and that is also an accolade and achievement that clubs us with the top 5% of the world's best business schools. We are also the only one in Pakistan, as I've mentioned, to have gotten this AACSB accreditation. Through this SDSB, through this School of Business at LUMS, we offer multiple graduate programs and undergraduate programs as well, but Knowledge Week series have basically been about the graduate programs that we are teaching, and we have already met you for our programs in accounting and analytics and supply chain and retail management in business and public policy, which was just yesterday. Today, inshallah, we'll be talking about the healthcare management and innovation program at SDSB, and tomorrow would be the day for technology management and entrepreneurship program. And tomorrow we'll wrap up the first leg of the Knowledge Week series. Then, inshallah, we're going to meet you again on Tuesday, and then on Wednesday and Thursday and Friday next week for the remainder of the graduate programs that are taught at SDSB. जैसे मैं हमेशा आपको बताता हूँ कि नॉलेज वीक एंड वेबकास्ट करने का बेसिक मकसद ये है कि हमें एक अपॉर्चुनिटी मिलती है टू कम्युनिकेट विद यू, टू गिव यू फर्स्ट हैंड इंफॉर्मेशन विद रिगार्ड्स टू what's required to enter the program, what your career options could be once you graduate, how rigorous the program is, how to ace it, what are some of the criterions in the admission criteria, and of course much more. But it is also your opportunity to get clarity with regards to any confusions that you might have if you're stuck somewhere in the application process, if you just want to learn how the whole healthcare system is in Pakistan, or any other industry in Pakistan for that matter, for which we have a degree program. We are here to actually help you out with your questions and your confusions. So welcome once again, and I'm privileged to be engaging in a discussion with Mr. Kashif Khan, Dr. Aimon Malik, and Dr. Rafi Uddin. Mr. Kashif Khan is the executive in residence at the Healthcare Management and Innovation Program at SDSB. Dr. Aimon Malik is a current student. You could also say she is an alumna, almost there, presently working at Shalimar Hospital. She also has a lot of experience, very rich experiences of working at numerous great organizations. She'll be informing you more about that. And Dr. Rafi is a current executive enrolled in our program, and he is also working with the health department, KPK. So many thanks to all of you for joining us today.
Welcome. Thank you.
Thanks for having us.
Kashif Saab, again, I'm going to start with you, and I'm going to request that you please start with the introduction of the healthcare management program, and also talk about the way the program has been structured.
Yeah. Thank you, Amar. Great to be back here. We've been doing this session for a while. Healthcare in Pakistan is going through a tremendous change. We are having a lot of hospitals, international standards hospital being built in Pakistan, and most of those require sound management. The recent epidemic of COVID just brought to highlight the management of response to the government response to the epidemic on community level. And this program was mainly a driving force for bringing professionalism in healthcare management. Healthcare is a very diverse industry, so it covers pharmaceuticals, hospital, biotech firms, and health insurance. And in Pakistan, lately, we have seen a surge in health technology firms. Technology has a bigger footprint in healthcare sector. We are having a number of web-based systems such as Olkadoc and others. Healthwire is another one of them. And healthcare management now is becoming a profession in its own right. So LUMS started the program last year. Aimon is the student of the inaugural program. And we looked at the industry before we started the program and the need for certain areas of management, because management is a broad area within health sector. And we designed the program to cover for the key areas which can apply in any of those subsector within health ecosystem. The program has 3 semesters. First semester, you learn the core programs such as business economics, You learn about organizations, how organizations operate, the leadership model, and how you manage change within those organizations. You learn about the financial management and accounting, which is a key area which is missing in healthcare. And generally, when you are a doctor or nurse, this is an area where you don't actually read so much about. But when you come to the real world, this is an area where you actually require a lot more of your energy and resources in order to make sure that your forecasting is right, your financial models are sound. You also learn about financial marketing management, so brand management, how you actually maintain your reputation, whether you work in a public sector or a private sector institute. Second semester takes you deeper into the healthcare side. You learn about the healthcare management system, the whole health ecosystem, how the curative system works with the preventative system. We teach you about basics of epidemiology. We teach you about healthcare policy, politics and law. And regulation, for example, Pakistan is having a growing regulation within the healthcare sectors. All provinces now have the healthcare commissions, which regulate the healthcare hospitals level. We also have DRAP, which actually manages the drug side, and pharmaceutical industry is directly affected by it. On technology side, we teach you how technology and the various laws, such as data protection, affects your institutes on that one. Then we teach you about innovation and entrepreneur in healthcare. That's where a number of our students actually have their own healthcare systems and institute, and they want to develop it. They want to take it into the next level. And we teach them about how the entrepreneurship works in that, how you can add value to your patient, how you can build a system which actually integrates with the wider healthcare system, such as the universal health system now. And we finally teach you about healthcare operation, the crux of the program, where Dr. Hassan, the program director, and myself, we both teach them. We teach them about forecasting, various system of qualitative and quantitative methods around that. And all of this is based on cases. A number of cases increasingly are based on Pakistan systems. So you actually learn the contextual way of how a healthcare system works in Pakistan, the challenges you have, and find solutions in discussion in the classroom. The added advantage here, Amar, is that you have a number of key speakers that talk about local systems and how you find solution at the local level. And at the final semester, you are actually working in a healthcare institute to apply your learning in a real world. And that's where you actually get your hands on to the real problem. You go through a methodology where you understand the data, you apply the data into various environments, and then you come up with a solution which adds to the host organization's roadmap, as well as enhance the patient care you offer. So in a nutshell, this is a program which is over 1.5 years. 1 year you spend at campus, and then the final 6 months you spend in industry. We looked at various options of where we can actually create more value for people who have their own businesses in healthcare and they want to enhance it. I will talk about that a bit later. So that's in a nutshell why the program was designed and what it offers.
Okay. Kashif, the way you have presented the whole program structure, I mean, I don't have anything to do with the healthcare management and innovation sector of the country, but I mean, it makes me, enroll in the program. You've talked about the biotechnology, you've talked about healthcare insurance, you've talked about the surge of the use of technology in the healthcare sector, in the hospitals, and then the regulations. And so previously, I was under the impression that it's just to do with the doctors, but as you mentioned, there's a great amount of need for people to train themselves in the overall management of the healthcare sector, and it has numerous branches. So thank you very much for this introduction, Kashif Saab. I am now going to go to Dr. Aimon, and I'll request first that you please introduce us, let us know about your own academic background, your professional background, and also talk about how this particular HMI program is connecting with the needs of the healthcare management domain. What you have seen, you've also worked at the Shalimar, you're working over there right now. And as a matter of fact, we are partners with numerous organizations. Great thanks to Kashif Saab and the rest of the program faculty. But Aimon, what do you believe, how are we trying to solve the industry problems?
Thank you so much, Amar. Like Dr. Rafi actually would tell you much better how this program has been facilitating us in our what I want to say, my need to broaden the horizon beyond just patient care and direct patient interaction. My personal experience and why I wanted to choose this program, from the very beginning, I knew there were loopholes, especially in the Pakistani healthcare system, to do with data and the digitization of healthcare data, and how these processes could be promoted into, let's say, a digital platform, into management systems, into systems that can be evaluated later. So because I graduated very, I want to say late 2019, early 2020, right in the midst of COVID, when it was reaching its peak, I really got to see the experience of how our healthcare system crumbles at the hands of a pandemic that we were going through. And in that, it sort of pushed me into realizing how these systems can run better and how we can make changes and very minute changes, because at the essence of it, we are lacking at even recognizing this as a degree in Pakistan. We are behind compared to at a global scale, and that is why the program at LUMS really intrigued me. And to be honest, I didn't think I would get in. I applied with a lot of motivation, but at the hands of COVID, because I was doing my house job, I thought this is a long shot, but this is something I'm so interested in.
But Aimon, why did you think that you weren't gonna get in?
Yeah, so I want to get into that. Why I thought, and why I feel like
applicants think.
Yes, because I felt like I was not up to par, but the reason, because honestly, as doctors, especially, I want to speak from personal experience. We don't get a lot of exposure in management or leadership classes or courses that could actually enhance this talk that we're having right now. And so just being interested in going through the interview process and really learning what changes can be made at global levels, because I had my experience from international hospitals and dealing with the healthcare systems in the US as well as in the Middle East. So I think that sort of gave me an edge, but again, I think it was the motivation. This is what I want to tell other clinicians that are trying to pursue this. Keep that motivation, because any place that you're learning something like this, it's new, it's different, but it's so much needed in our society, in our culture, and in the current healthcare system. And again, from the learnings, like Mr. Kashif said as well, the case study method and the whole idea about using this data, because it was still from the international resources, we are lacking data in our local context as well. And it was so refreshing to sort of getting to apply it right now, where I'm working at Shalimar as part of my field thesis, as part of my final semester, towards the end of it, inshallah. And getting to apply this knowledge and getting to sort of see the feedback and working on change management and adoption and the buy-ins from doctors and clinicians and administration. It's really challenging, but again, this is what I was hoping from, and I'm so excited that I'm getting to do this right now.
Thank you, Aimon. You also, talked about multiple things, but I think that I was actually very, very interested in knowing you saw the whole pandemic management situation in Pakistan as crumbling. On the other hand, the government doesn't see it that way. So maybe this is something where Dr. Rafi can comment. And Dr. Rafi, before you start with that, with the pandemic management and everything, I would also like to learn about your, academic background, your professional background. What was the primary intention behind joining this program? And I'm sure you must have done your own research as well before joining this program and similar programs offered at other universities. So what made you sign up for this program offered at LUMS?
Thank you, Amar. Yes, indeed, that was what I was thinking of starting myself. The why part, why I joined this program and why I joined the program specifically at LUMS. My background is I have an undergraduate, before this program I had an undergraduate, I have an MBBS from Khyber Medical College, and I graduated in 2008. So after 2008, take it up forward to 2016, which is almost 10 years. In this 10 years, I was primarily in my clinical side. And I would jump. I did my USMLE. I went back to US. I did my FCPS. I applied for the DHA. I went to, but it wasn't clicking. I wasn't getting that spark. I thought something is missing in me. And all of my relatives would say, you've passed all these exams. Why are you not getting into residency? Why are you not going to clinical workshop? You're wasting your time. Life is going against you. You're going up into your mid-30s now. Something's wrong in your head. Go see someone. You're a citizen. You have a US. You have all the opportunities and everything. Something's not right. Then after I joined the government, this was in 2016. When I joined the government of KPK, I joined as a regular medical officer. I climbed the ladders for first year. When the managers of the system saw that I had a little bit potential, they picked me up without having an MPH. At that time, this is the only credential for getting into administrative degrees. So I was put into an administrative position without an MPH. So at that time, I was thinking I would go ahead and get an MPH and further my career. This was the turning point around 2019 that I realized I need something in regards to management problems I have to solve, but the processes are not right. And the missing links, and even the managers are looking at it as an MPH side, which is not the managerial side. It's more of a community kind of a medicine thing where you would apply it in another context. So this is where I saw that there was something missing in the system, and we needed managers who had some kind of a managerial experience, such as the MHA, Masters in Healthcare Administration, the MHM, the Masters in Healthcare Management, stuff like that. So my first thing was to go back to US. Since I have my undergrad from here, I was not looking for any kind of degree from Pakistan, to be very frank. The first things I started was going to SOFAs. I went to apply to various credentials. I converted all my credentials through the World Evaluation Services, and I was done for Texas. I had applied and I had saw the program that it's AACSB accredited. Then I didn't know what AACSB is. So I went to AACSB. I tried to figure out what AACSB is. Why do the US people prefer that? Why do employers prefer that? Why do we have a competitive advantage in that regard? So this was something that I had in the back of my mind. So once I figured out that AACSB is a very big thing, only 25% of the business schools in US are AACSB accredited. So then I randomly typed AACSB Pakistan. And the first thing that came up was LUMS. And that was the only institute that I saw. Then I asked a couple of people, and they said like LUMS is like, before that, being a resident of KPK, not a lot of people are even well versed or aware that there's an institute called LUMS, and it's like Ivy League, and you can be a part of the system. It's not that well aware of people. People aren't well aware of that in this part of the country. So anyhow, when I got a hold of this whole application process, I applied. And just as Dr. Aimon mentioned, I had no intention of getting in. I knew I didn't have that kind of the traits that probably they were looking for, because I probably, in the back of my mind, I was thinking of Wharton Business School and Austin and stuff like that. So anyhow, I was very surprised that when I got that email back, and I literally was crying with happiness. That okay, fine. I don't need to go to US, and I can be in the system. I can be in Pakistan. I can be with my parents, and at the same time, I have an executive degree where I don't have to go and be there. I can be with my career, and I can progress in it, and I can probably apply whatever I learn at that very moment and apply it to practically in the system where I am as an employee. So this was very cool for me. And as we progressed and I got admitted and the system started, and now my practical experiences has been this, that whenever I learn anything new, I try to find where I can apply that process in my current job process. And it has really helped a lot, where I'm seeing a lot of gaps being identified and trying to fill them up. But there are a lot of bottlenecks that it's not in our control. And
but of course, the healthcare program is training you to,
this is where innovation comes to play.
Exactly. Thank you so much, Dr. Rafi, for sharing your own very personal experiences with us, and we are also very, very honored at LUMS to be the only institute in Pakistan with AACSB certification. And yeah, there are no other universities right now. I am sure there are universities, there are institutes who are trying to get that, but of course it's a lengthy process and it takes time. And inshallah, Pakistan will also be there one day where many other developed countries are. At the same time, before we move on to Kashif Saab, I would like to, for the benefit of our audience, I would like to let them know that the admission criteria to apply to the Healthcare Management and Innovation MS program at LUMS is that you, number one, have to have 16 years of education. Then you need to have taken one a test, which is basically a part of the testing criteria. So you could either go for GMAT or you could go for GRE. And then if you don't want to go for either of the two, then again, you could opt for NTS SCAT. That is also an option. Here you have to make sure कि आपने अपनी online application जो है वो completely fill in करके हमें send की है. And even the supporting documents are to be sent to us online. Nothing has to be sent to us through mail. और या आपको खुद भी hand deliver करने की जरूरत नहीं है. सब कुछ आपने हमें online देना है. And then the final part of this process is the interview, which I think, in my own opinion, and as I've conducted multiple webcasts now, and I've lost count as well. लेकिन मैंने जिन भी faculty से बात की उन्होंने हमेशा एक बात बताई है कि the most important things is probably the interview. Kashif साहब अभी बताएंगे इस बारे में ज़्यादा, but Kashif साहब, before I come to you with a question of my own, we have a number of questions coming up on social media, and the first of all has come from Sada, and this is, is this degree beneficial outside Pakistan? And can someone work after having it? I don't know what Sada meant when she wrote work after it, because it basically designed that way, but maybe meant as work as a doctor or as a medical practitioner. This is question number one.
Yeah. Actually, man, the year degree MBBS nahi hai. I mean, this is a management degree. And yes, you can go abroad. You can pursue, for example, if you want to do PhD, you can go and further that. As Rafi just mentioned, it's the only university in Pakistan which is recognized for ACCBA. So you can actually take your degree. You don't have to explain what you have learned, because LUMS is part of that. The main crux of it is that you can learn the skills which can apply in the healthcare sector anywhere. So if you want to go into work, I mean, for example, kind of work you can get into, as I said to you, we have a number of hospitals built in Pakistan. Look at Shifa, Shaukat Khanam, Aga Khan. They're all professionally run organizations. They have structures. Evercare Hospital is the new one that just come on board. So all these hospitals require management. They need management right throughout the organization, and you can join one of those organizations. We have a member of understanding where we have internship programs with Shifa, Shaukat Khanam, Evercare Hospital, as Aimon mentioned, Shalimar, and also in public health. For example, Contact International is a major consulting where we actually look at the international dynamics of the healthcare systems in Pakistan, and we do consultancy. So some of our students are actually there and learning the whole systems approach. And that's where you can actually go into healthcare consulting. So you have three options open to you. A, you can set up your own healthcare facility, any business, healthcare technology firms. Second, you can do work. So you can actually join one of the hospital. Third, you can actually go into health consulting, so which is a larger part of it, and you can work with a major consulting house, or you can work with one of the ones in Pakistan or within the healthcare department like Rafi is doing. So you have various option opens to yourself.
Kashif Saab, thank you very much for this answer, and of course this was what I was expecting as well. Mera ek question hai, and this is something that I've tried to handle on my own previously with many other candidates who tried to apply to the Healthcare Management Innovation Program, but they've always shared this concern, and it has come once again as a question from Shahid, and he's asking, is this program recognized by PMC? So my question is, does it require to be recognized by PMC?
No, it doesn't, simply because it's a management. PMC regulates the clinical side of things. This is a management. So it doesn't need recognition from PMC. It is, however, recognized by the Higher Education Council in Pakistan. So if you go and apply yourself in a government setting, then you have to be in one of the HEC recognized program, and this one is. It doesn't require from PMC or Dental Council or Nursing Council, because it's not one of the clinical program. It's a healthcare management program.
Okay, and does this also mean, Kashif Saab, now that you've mentioned that this is an HEC recognized program, and that's why we have been teaching it at LUMS. So anybody who wants to pursue a PhD program after that, could it be considered as a stepping stone towards that?
Indeed, it can. And a
this
couple of our students have already got an offer from the PhD. So they're going further, Europe and US, to learn about the healthcare systems at a more complex level. So you can pursue the PhD. What the purpose was initially is to build the capacity of healthcare management in Pakistan. This is where it's lacking at the moment. The program is focused about teaching you the operations in context of Pakistan, but you want to apply that and you want to pursue that in US. Interesting enough, LUMS has one of the greatest footprint in PhDs abroad. So this is a very handsome footing to be on if you want to pursue yourself further education, not necessarily a PhD. You can go and do health informatics, which is a major component in Europe and in America. And artificial intelligence, use of how we use artificial intelligence using the health data. Machine learning is another area. The health technology firms, again, you can go and study further in Europe, across the world, because one of the degrees that we have is recognized across the globe. So you have advantage either way.
Bilkul Sai, Bilkul Theek. Thank you so much for this clarification. And as you mentioned, it's primarily focused on the management aspect of the healthcare industry in Pakistan, even outside Pakistan. So it doesn't really have to be, PMC recognized. It's not an MBBS program, as you mentioned. At the same time, Kashif Saab, you have been working at LUMS for a number of years now, and you have had the opportunity to teach numerous students and interview them before they join our program. So in your opinion and in your observations as well, who would be and who has been an ideal candidate for this HMI program that we offer at LUMS?
Initially people think they have to be MBBS doctors, and yet less than half of our class are actually doctors. So we have people from nursing area. We have people that actually run their own hospitals. We have people who work in health in others, for example, fundraising and other things. So you don't need to have a medical or nursing degree or allied healthcare professional to be in there. So anybody who's, as you said, 16 years of education, we do actually test them in interview. What is their purpose to join? So if you want to make a difference to the Pakistan's healthcare system, if you have an idea and you want to pursue it and you want to know how to actually establish a healthcare enterprise, this is the program for you. And Amar, if I give you an interesting fact, 75% of Pakistan's medical students are female, and yet only a quarter of them end up practicing it. So in this program, we offer 50% scholarship, so they can actually go back and use their skill. That's a huge talent in Pakistan, which is untapped. So they can find themselves healthcare management, which is where you can maintain your work-life balance. And this program is also executive program. So you actually learn over the weekend. There is a hybrid model. So you learn some in class. There's a greater interaction in the class. You also have some classes online. So in case of what Rafi is going through at the moment, is where you actually only on campus once a month. And then one time after fortnight, you actually are online. So you can actually maintain your profession if you're a doctor or if you're running your business. And you can also be a part of the program. And as Rafi also mentioned, you can actually learn something in a class and apply straight away. And you can bring it back to the class, and that's where it enriches it. So you can try different things and you can see how it practice, have interaction with your colleagues. Most of them, most of the people, as I said to you in a class, they're not purely medics. They're people who have their own facilities. There might be doctors who run clinics. There might be people who are actually non-medical and running healthcare facilities or biotechnology firms. And they want to understand how the healthcare system works and how they can add value to the patient. And also looking at preventative side, how we can actually come up with solutions which prevent people getting ill in the first place. So it gives you the wholesome experience of what healthcare is, how important it is for you to be a very good sound manager and a leader within healthcare, clinical leadership, for example, and how technology has various opportunities within healthcare sector, not only in Pakistan. Once technology is involved, you can actually offer telemedicine, for example, the use of remote working. All these sort of things can actually add to your skill mix, which you can actually, with entrepreneurial mind and innovative mind, you can actually apply in any settings.
Exactly, बिल्कुल सही. And जैसे आप काशिफ आप कह भी रहे थे अभी कि yes, this gives the executive nature of this program allows you to learn on Sundays, learn on weekends, apply on Mondays and the weekdays. So yes, that's very important. And Kashif Saab, before I go to Aimon and have and speak, I have this question: does this program require candidates to have some prior experience before they join us?
It does help. Because you need to understand something about the healthcare system. Having said that, it's not mandatory. When we actually do the interviews, and I sat through interviews now 2 years, and I think the reason Aimon and Rafi thought they couldn't get in is sometimes the kind of question we ask, because we need to actually delve deeper than your personal statement to understand your motivation for the program and whether you are ready for a commitment. It is an intense program, and no doubt about it. And Rafi could share.
Well, if it's a LUMS program, it should be intense.
Exactly. So I think you need to be clear that you have time for it, and you have a motivation why you want to do it. And it may be that you come to program, you might thought that you actually want to do one thing, and you come to program, have a discussion, and you find out actually, no, I might want to pursue something different. But nonetheless, from the outset, you need to be clear in your mind why this program is good for you. As I said to you, we're looking for people who are change maker within health. We are looking for people who have inspiration. They might have gone through an experience in the healthcare system and they thought, this could be done better, but I don't know how to start. I don't know how to make it work. And that's where you bring the ideas to the class and you interact with the faculty. And to give you an indication of a faculty, 80% of faculty actually are PhD from abroad. They have over a decade of experience. So you actually interacting with people who taught business at a very senior level. They can actually give you ideas, they support you. And in my 2 years in LUMS, I enjoyed, because I came from UK, and when I came to LUMS, I found the faculty was so committed to the students' well-being, and they actually, any ideas that you come to, for example, Aimon can share something that they're actually working on at the moment, and how faculty, different faculty that actually taught them previously, are still engaged with them to say, how can we take this idea, build it into model which is sustainable and which is financially prudent. So that's the advantage of it. Anybody can apply. They don't need to be a doctor, they need to be a nurse, but you need to be clear, what value do you think this program can add to your career or your ambition?
Exactly. Or यही वाली बात जो है, I keep saying over and over again कि before you apply to LUMS, and I'm going to again say it, कि before you even think about applying to LUMS, please make sure you have a clear idea of what you want to do, how you want to add value to your organization, add value to your own self, or maybe to the society, and how also have some idea how LUMS can actually help you get there, because these 1.5 years or 2 years, they're going to be rigorous, but at the same time, they're going to be immensely valuable. And I am quite sure that you will be thankful once you graduate. But coming to Aimon about that, Aimon, how do you think a LUMS program changes a person? Okay, so before you join LUMS, the kind of person you were, the kind of work ethics you had at that time, or the time that you had for studying and all of that, and now that you are about to graduate, what difference do you see in your own personality and maybe in the personalities of your classmates as well?
Well, for one, just reiterating what I said before, and Dr. Rafi even agreed that we had no intent, we had no motivation or surety that we were going to get in. And the reason for that being, one of them was the underconfidence. If me being an entry level, or I suppose I thought my CV was very entry level. It was not very, it was not as esteemed as LUMS, not up to par for LUMS's expectations. But I think the one thing that I think the reason I got in, and I believe this should be a surety for anybody else who's seeking to come into this program, is the interview. And because I had a very clear head and clear vision what I wanted to pursue from this degree, and what sort of change I was looking into, and why I want to switch from my clinical side to managerial side, or not really switch, but broaden my experience and learning about the healthcare system. And so yeah, so starting off from that underconfident woman, I think one thing that sort of enhanced my professional experience is becoming more and more confident in what I want to achieve, and really pushing it and putting it out there. Because I learned this from beyond just the classroom interactions we had with our esteemed professor, Mr. Kashif being one of them. I sort of learned.
आपका कोई grade तो नहीं रहता जब भी काशिफ अपने mark करने?
maybe, but
रफी साहब के तो भी काफी
for
grades
real.
हैं.
Well, I'm still enrolled in the program, so we'll find out. But no, really, because I pursued, me and another friend of mine, we both came into this program together. We sort of aligned our heads and we came up with this innovation in health technology that we sort of want to push into the system, and the learnings from our classroom and beyond the classroom, and then the guidance given from our professors. It has been so immense, and it has been such to a most candid and very personal level. It has been really pushing us to pursue it, especially being a woman. I know the challenges that come with pursuing a career beyond just a day job and wanting to dip into the realms of entrepreneurship. They've been super motivating. They've been really helping us out with the things that I never thought that I'd have to face, other than managerial and leadership, the financials, the procurement and the project management, the change management. Again, these are things that I never knew existed until I came to LUMS to learn about the managerial side of hospitals and operations and the policy making, what goes into like even starting up a business, what goes into trying to get a buy-in from doctors into digital innovation or technological innovation. So yes, so definitely confidence, definitely a lot of motivation, and a lot to learn from on-field work, which I feel like it would have been lacking if I had pursued it anywhere else. So thankful for that, obviously. Yeah.
So confidence, lots of motivation, and then also the ability and the possibility to work with esteemed organizations in the industry. Yes, bilkul sahi. Dr. Rafi, I have a similar question for you. And there's also a question that has come to us on social media that is from Faiza. And she's asking, so she is a student of management, but she's also asking, what is the scope of management in Pakistan? Now that I understand is a very, very huge question to ask in terms of its diversity. Again, at the same time, if we have to narrow it down to the scope of management in the healthcare sector, you work for the government sector. In the government sector, how do you see what are some of the opportunities that exist in the healthcare management sector for the people who will now be joining the program and would be entering the market from 2 years from now?
From the government side?
Primarily from the government side, yeah.
Well, keeping in view the healthcare organization as a whole, and the multiple parallel vertical programs, and in addition to the hospital programs and the projects that are set up by various governments, whether it be Punjab or KPK or Sindh or Balochistan, most programs ultimately main goal is to provide equitable healthcare to the public. And in that regard, which is the whole agenda of the most countries in regards to GDP or economic growth, a better healthcare society means a better economy, and it's a domino effect for the whole country. Management is very important in this regard, that it is a complete whole science. It's something brand new. It's something that it's very difficult for us to apply that, because there has not been a lot of research done in regards to Pakistan for that matter. And in that regard, the market is so huge and the opportunities are so large that there is 2 years is very short. I mean, I'm thinking maybe for the next 10, 15 years, there are so many opportunities that can be done, that this is a developing country, and we still have a lot of opportunities available. So in that regard, the question that was put, that is, you don't have to worry about any jobs once you're done with this degree, because you have so many consultancies going on, you have so many sideline stuff going on, that the more you go into the semester by semester, you will realize that you see an opportunity in your own hospital, you see an opportunity in your own projects. You see, as a government, I see that there are a lot of bottlenecks within our own system, where the HR is not accountable, the HR is not being fully utilized, the capacity, the scheduling is wrong. There are small nitty-gritty where when you define them, the whole process becomes very smooth, and it's fixable. The only difference between government and the private sector is that the private sector already knows this, and those individuals who are in it, they've already established a foolproof manner where they actually utilize their HR to the maximum, which ultimately creates a domino effect. The problem with the government side is that it's very difficult to manage the HR part. In Pakistan, as a government servant, utilizing HR is the most difficult task. And once you can utilize that task, everything else falls into play, and it's placed very, very perfectly.
Exactly. I think it all comes down to managing people. I've been reading a book. I think it's right over there, The Leader in You by Dale Carnegie. And it comes down to the same point over and over again, that you will have to manage people, and the one who is able to manage people effectively is the one who leads eventually. So I think you've pointed it out.
And I think just to add to what Rafi just said, private sector is not much smarter either. And Aimon can share, I think the number of, because we don't use technology in this country as much. So if we don't have the technology, we don't understand where the patient's coming from, the peaks and troughs of it. And as Rafi just mentioned, managing demand, we have finite resources. We're not like a Western country, so we have infinite resources. So we teach you about how to manage demand within existing resources, how we forecast better, how we may build quality systems within a hospital. Number of hospitals in Pakistan want to go for JCI accreditation, which is the premier healthcare accreditation for hospital. And yet we only have 3 hospitals currently, Shifa, Shaukat Khanam, and Aga Khan. And our motivation—
And 2 of these hospitals are our partners as well.
They are partners. We are talking to Aga Khan as well. And we want to have more of those in Pakistan. So quality is at the forefront of everything they do. Managing their staff, managing the patient flow smoothly, having a bigger footprint within the healthcare in tech industry is major components of this program. That's where the innovation part comes in. So it actually gives you various options after this.
Bilkul say. Kashif sir, I have 2 more questions, and then I'm also left with only 4 minutes to keep this program running. But before I come to you again with those questions, I'd like to let our audience know that there are multiple ways to finance this program. One is already the one that Kashif sir has already talked about, that is the 50% women's scholarship that we offer, not only for the HMI program, by the way, but for all the graduate programs that are taught at STSB, the business school. We're probably the only university in the world, or probably amongst the very few universities in the whole wide world, offering this kind of an arrangement for women candidates. At the same time, there are merit scholarships also available for each MS program offered at STSB, and then there's an option, get a loan to finance your program, and then that loan, you can take it right now, and then it becomes payable in very easy installments once you are done with the program, and once probably you would have found a very decent job by that time. Kashif Saab, a question is that I've got over here is from Shahid. He's asking, does the MS program require any previous research experience, or does this program have a research component to it?
There is no requirement for you to do any previous background into research. However, to get in, so you don't need to have a research. You need 16 years of education recognized by Higher Education Council of Pakistan. And then after that, we, as I said, looking for motivation. What is the purpose why you want to get in? This is the most important part of it. And as you mentioned, they need to have one of the entry exams, so either GRE, CAT, or GMAT, one of those. And then your purpose, what you want to get out of this program. So there is no reason for you to actually have a research background. In terms of research within the program, you do carry out in your internship an action research. So you're actually doing something and you're making the secondary research. So at the moment, Aimon is working on applying the healthcare management system in hospitals. So secondary research she's doing is looking at the HMI system, the information systems in other countries, how they apply it and the benefit that drives. So you do actually do research, part of what you're doing in your internship, but in terms of the background, you don't necessarily need any research background into it.
Perfect. And also, how many seats does this program have?
We have 50 seats available. However, our admission criteria is very rigorous. So we don't fill up the numbers. What we're looking for is people who can actually contribute something and which something they can learn. We're looking for people who have a genuine reason to be at LUMS and they can fit into a very rigorous program. So they have the time, for example, available, and they do know what it takes to study for 1.5 years. Just as Rafi said, 1.5 years seems sort of a shorter period to compress so much in. So you really do need to have your work-life balance sorted, and you be very clear what this demanding course requires from you. And then there's no reason. I think my message to people would be apply. You know, anything you do in life, don't sit on the sides. Do apply. And
exactly.
And as Aimon and Rafi just said, they didn't think they will get in. And Aimon is about to graduate. Rafi is on the second wave. So if people sit there and say, what is LUMS? And they're saying they're looking for clarity. Well, these are the kind of things we discuss with you in the interview stage. So let's do apply and do put down your motivation. Be very clear what you want to do. And then I do wish everybody good luck with it.
Thank you so much, Kashif sir. Aapki baat se mujhe yaad aa gaya. You will miss 100% of the shots that you will not take. So please do apply. Don't sit on the sidelines. Yes, Dr. Aimon, Dr. Rafi thought the same that they wouldn't get in. They are graduating very soon, inshallah. Again, thank you, thank you, Kashif sir, Dr. Aimon, and Dr. Rafi for joining us today, for taking time out from your very busy schedules. We understand that. But before we go, once again, I'd like to remind you that we are done with 4 webcasts for 4 different graduate programs: accounting analytics, supply chain retail management, business and public policy. Today our discussion was about the healthcare management innovation program. Inshallah, tomorrow our webcast will be about technology management and entrepreneurship program. So please make sure you're joining us there as well. And also, if you have any further questions, there's a lot of information with regards to the program, with regards to the business school and LUMS available on our website. So please do browse www.lums.edu.tk. Create your account as soon as you can. And if you get stuck somewhere, our admission representatives and our program faculty as well as program team are available to help you out wherever we can. And yeah, take good care of yourselves. Inshallah, we're going to see you tomorrow.
Thank you.
Thank you.